You may have heard about the twisted case of Dr Thomas Kwan. He is the GP who's gone on trial after being accused of trying to kill his own mother's partner by injecting him with poison. By disguising himself as a nurse, Kwan administered a fake COVID jab, which was in fact a pesticide, leaving 71-year-old Patrick O'Hara hospitalised. Well, Kwan is due to be sentenced this week. So what is behind the murder plot? I'm Lucrezia Millarini, and this is what you need to know. Hello and welcome to today's episode of What You Need to Know, and I'm joined by ITV Tyne Tees reporter Katie Cole, who's been looking into the case of Dr Thomas Kwan. Welcome to the podcast, Katie. Listen, some of our listeners may be aware of this terrible case, but for those who aren't, just tell us a bit more about what Thomas Kwan did.
Yeah, hi there. Well, Thomas Kwan was or is a 53-year-old man, and until recently he was a respected GP. But he has a darker side. And last week at Newcastle Crown Court, he, like you said, admitted to attempting to murder his mother's partner. He went into their home disguised as a community nurse and told Patrick O'Hara he needed a COVID jab. But it was poison and it left him seriously ill in hospital. Now, the motive for this attack was financial. Thomas Kwan was obsessed with getting his mother's inheritance. Now, she's called Jenny Ling, and she owned the house she shared in Newcastle with Patrick O'Hara. Now, her will stated if she died first, Mr. O'Hara could stay in the house. Only when he died would Thomas Kwan inherit the house along with his sister. So Kwan was upset about this. He'd fallen out with his mum and Patrick O'Hara, and they'd been estranged for more than a year before the attack.
Katie, it's really shocking, isn't it? And some people would have seen the images of him in this disguise where he's pretending to be a nurse. I mean, at what point did his mother and her partner become suspicious that this nurse actually looked a lot like her son?
Yeah, so, I mean, before the visit took place, Thomas Kwan had really planned this attack. He'd sent fake letters, a fake text message to Patrick O'Hara, pretending to be from a community nursing team, telling him because he was over 70, he was eligible for a home visit. Thomas Kwan booked the time off work at the GP surgery in Sunderland, so he was free on the day of this attack. And in January the 22nd, he drove from his home on Teesside to Newcastle. He checked into a hotel using a fake name, and the CCTV shown in court was quite incredible, really. He goes in, checks into the hotel, and then we see him a few hours later, and he looks like a totally different person. He's got a surgical face mask on, a hat, he's wearing gloves, and he walks from the hotel 10 minutes or so to his mother's house. They're obviously expecting a nurse. They've had the appointment letter being sent in the post. So Kwan goes in disguised as the community nurse. He fills in a health questionnaire with Patrick O'Hara. He takes his blood. He asks for a urine sample. He does his blood pressure. He even does his mum's own blood pressure, but she is still totally oblivious that it's a son behind the mask. He injects he's told them is a COVID booster jab into Patrick O'Hara's arm. It's painful. It causes Patrick O'Hara to jump, but Kwan reassures him it's totally normal. It's just a bad reaction. Now, the mum and Patrick O'Hara specifically only becomes suspicious after he's gone, because his mum makes a comment to Patrick O'Hara like that the nurse was the same height as my son. And it's only then with his arm that's really starting to hurt does Patrick O'Hara believe that actually it might have been Thomas Kwan behind the mask.
Goodness me, so much thought, so much planning had gone into this, as you say. Following his arrest, though, police made some really shocking discoveries, didn't they?
Yeah, so at this point, Patrick O'Hara is in hospital. He is found to have this rare and flesh-eating disease, and police are trying to work out what he's been injected with. So they searched Thomas Kwan's home, and it was described in court that what they found showed Kwan's borderline obsession with chemicals and poisons and how they kill human beings. So in his garage, they found arsenic, the raw ingredients to make the chemical weapon ricin, and a pesticide called idomethane, which it's what Mr. O'Hara is believed to have been injected with. And it's something that's never been injected into a human human before. So it was making it really difficult for doctors to treat Patrick OHara. They also found on Kwan's computer a poisoner's handbook that had been downloaded, a book on guidance for murder investigations, and the picture that you'd mentioned that's been in all the newspapers, which shows Kwan in this disguise with a wig and fake moustache. And it's believed that this was fake ID in case Patrick OHara had asked to see identification on the day of the attack. Now, Kwan Street was cordoned off for several days. There were officers in blue hazmat suits coming in and out. It was a major operation. And where Thomas Kwan lives on Teesside is in a place called Ingleby Barwick, and it's quite an exclusive, quiet area. And I've spoken to some neighbours there who just have told me that they couldn't quite believe what they were witnessing.
Swamped with just emergency services, and the worst part is you know there's something happening, something big, something different, something scary. It's not one of those routine things that you kind of hear. You read news and in other places and you say, oh my God. And to have this oh my God moment in your neighborhood with your neighbor, you just feel a little uncomfortable.
There were tents everywhere and people kind of going into the house. The scale was pretty large, and we were kind of anticipating something big was happening here. But just to be living in that fear, not knowing what it is and how safe we were feeling at that time, it was a little uncomfortable.
Katie, oh my God, indeed. But, he left quite a few breadcrumbs, didn't he, for investigators, when you think about it?
Yeah, no, he absolutely did. I mean, police were able to track him back through the CCTV and the fact that he had fake reg plates on his car. When we've been covering this case, people have said, oh, it's like something out of a Netflix or a Hollywood movie. And the prosecutor actually opened the trial of Thomas Kwan by saying sometimes the truth is stranger than fiction. And, while it's fascinating for many, I think it's actually really troubling, especially for those that knew him, and particularly former patients. So he was a doctor at a surgery called the Happy House Surgery in Sunderland. And we've been speaking to some of his patients there who say, to see his face and this disguise all over the media is really shocking.
It come up on the news on Facebook when I was like, oh my God, that's my doctor. And I literally only saw him on the Thursday. And then that all come out on the Monday, and I just couldn't believe that he would actually do that to a family member. I just think he's broke every code there is, hasn't he? Like, he's just broke every law that there is for doctors. Like, you shouldn't do that no matter who it is.
Wow, that really doesn't look at him at all.
So
only by the eyes is only how I can recognise him. The rest of him doesn't look at him at all.
And how does it feel to know that that's like your doctor?
Yeah, absolutely terrifying. Do watch a lot of crime documentaries and stuff, like usually in America and things, but when it happens that close to home, it's even that bit more terrifying.
So the Happy House Surgery say as soon as Kwan was arrested, he left. They've carried out an audit of patient records and are satisfied that this was an unrelated and personal matter. At no point did Kwan pose a threat to any patients. I also think some have, when I've been covering this case, people have said, how did his mum and partner not know that it was him dressed as the nurse? But I think the fact that the letters had been sent, there was the text message, he manipulated his way into their home. And that's what criminal investigator Jen Jarvie told me too.
We know how much we trust a uniform, and unfortunately, there are some bad apples there. He used his profession to be able to have the knowledge to do it and to have that trust, that automatic trust of, you're coming into my home, you're giving me a COVID booster, you're trying to help me, so I'm more than willing to let you do that. And obviously the consequences of that for his victim were horrendous.
And Katie, what of his victim now, Patrick OHara? How's he doing?
Well, we know that he spent weeks in intensive care. He had to undergo a number of operations on his arm and have plastic surgery. Northumbria police have praised his strength during their investigation. They say they hope the fact that Kwan is now being brought to justice will help him try and move on with his life.
And Kwan is due to be sentenced this week. What do you think will happen?
Yes, so he'll be sentenced on Thursday. A lengthy jail sentence is coming his way. His barrister has said that he entirely accepts prison is inevitable and he's keen to be sentenced as quickly as possible. And the judge said that there would be a substantial custodial term. He initially denied attempted murder and said that he only wanted to cause mild pain and discomfort. But after the prosecution opened the case with all the details that I've just outlined, Kwan changed his plea to guilty. And what Thomas Kwan set out to do has actually been described as one of the most elaborate criminal plots in recent memory. Fortunately, Patrick O'Hara survived, but as the police have said, his life has been changed forever.
Yeah, well, Katie, what a fascinating case. And as you say, thankfully, he didn't achieve what he set out to do. Katie, thank you. And thank you all for watching. For more on this, head over to our website and have a look back through our other quick briefings on a range of headline topics to find out what you need to know. Until the next time, thank you.